Good evening. Welcome to another edition of the 411 Talk Zone radio show, Red Pill Edition. My name is Leon Jones, and in this segment, I'm going to get right back into the psychology. Now, it is very important that you view this video in its entirety before you comment. Now, I know there's some individuals that'll go ahead and look at 5 minutes and they'll thumb it down or thumb it up, but you're not getting the information. The purpose of all of my videos is to teach. Now, again, the layout, the lighting is not perfect. I do cam up and I am working on doing something with StreamYard, which once I get that concept down, I can start off with some live panels. But for right now, you're going to get pre-recorded content. And I know right now panels are really big. And I agree with that. Panels do help your views. But what I'm going to do is my part in the manosphere is to really look at psychology because there are a number of us who, for the most part, we have some issues. And I don't care whether you're black, white, yellow. Many of us need to seek help, but we don't ask for help. Many of us have anger issues. Many of us are very narcissistic. Many of us are egotistical. We get overconfident and we think we're right. That's a problem because somebody who is overconfident can also be insecure. But what I'm going to get into tonight is borderline personality disorder. And I'm seeing that a number of people do have BPD. So the title of tonight's video is going to be borderline personality disorder, signs, symptoms, and treatments. Borderline personality disorder, signs, symptoms, and treatments. Before I get on, let me give a shout out to Little Big Nate, Trady NBD, Belly Mel, Shark Simmons, Hood Conservative, Theo Woff, Celine. There are others, but the list is too long to mention. Now, also, I would like for you all to support my channel. Go down to the link at the bottom of my video, click on the Cash App. My Cash App is $LEJ010265. Without further ado, let's get into the topic as I share my screen. Now, when we talk about any type of topic, whether it's a mental disorder or a political topic, you should go ahead and define the topic. You want to get your audience engaged. Now, I know this right here, it's not drama. And I don't intend to it to be drama. Why? I know in the black community, drama sells. But right here, as my name is Leon Jones, my government name, I operate my channel, the 401 Talk Zone radio show. I don't do drama or I don't do beefs. But I will tell you, I guarantee some of the individuals around the circuit in black YouTube, they're going to want to listen to this because I guarantee that they have BPD, borderline personality disorder. So the whole overview is basically BPD is an illness marked by an ongoing pattern that has varying moods, self-image, and behavior. Now, the symptoms often result in impulsive actions and problems in relationships. Now, people with borderline personality disorder may experience intense episodes of anger, depression, and anxiety that can last from a few hours to days. Now, again, like I said, what are the signs and what are the symptoms? Now, it seems like people who have borderline personality disorder, because I gave you the overview, if you really analyze the situation, doesn't it seem like people have a Jekyll and Hyde personality? They can be angry one moment, they can be calm or depressed the next moment. Well, the reason why that happens is because people with BPD always experience mood swings and display uncertainty about themselves. Again, they experience mood swings and they display uncertainty about how they see themselves and their role in the world. So, as a result, their interests and values can change very quickly. Again, they can change with the weather. So, a number of individuals who have BPD are very, very unpredictable. Now, people with borderline personality disorder also tend to view things in extremes, such as all good or all bad, because their opinions of other people, again, can change very quickly. You see, an individual who is seen as a friend one day may be considered an enemy or a traitor the next. These shifting feelings can lead to intense and unstable relationships. Now, the reason why that happens is people with borderline personality disorder tend to be very, very unstable due to the mood swings, and it's almost a guessing game with them. And I know myself, I I am not patient with people like that. They would get me to snap because you don't know where they're going to come from. So what you got to do when you believe somebody has a borderline personality disorder, you got to try to get them to seek help. Now, other signs or symptoms of BPD will include efforts to avoid real or imagined abandonment, such as rapidly initiating intimate physical or emotional relationships or cutting off communication with someone in anticipation of being abandoned. There's also a pattern of intense and unstable relationships with family, friends, and of course, loved ones, often swinging from extreme closeness and love or idealization to extreme dislike or anger, devaluation. Then you have distorted and unstable self image or sense of self. Then again, you get into the word impulsive because when you have BPD, you're going to be impulsive. And along with being impulsive, you're going to express some dangerous behaviors. And then when I say dangerous, everything doesn't tend to lead to violence, but some things can lead to almost suicide, like killing yourself. And I'm going to give you an example of that. Now, a dangerous behavior that I'm going to tell you is when you get depressed or when you are high on anxiety, you tend to spend more money. That's very impulsive. And you spend money on materials that you don't need. You're also going to practice unsafe sex. You're going to get substance abuse. You could have reckless driving, binge eating, and of course, binge drinking. Now, If these behaviors occur during a period of elevated mood or energy, again, when I do psychological disorders or psychology, there's always a connection. Now, when you get an elevated period of mood or energy, there also may be signs of what we call a mood disorder, not borderline personality disorder. Then you're going to have other symptoms within BPD, such as cutting, which is a self-harming behavior, recurring thoughts of suicidal behaviors or threats, intense and highly changeable moods with each episode lasting from a few hours to a few days. You're going to feel very empty. You're going to feel very inappropriate. You're going to have intense anger or problems controlling anger. And if you've been in bad relationships, and we all have, one thing that you're going to deal with when you have BPD is your ability to trust. You're going to have basically a rational fear of other people's intentions. But going back to the relationship part, you're going to have feelings of abandonment. And this is also where feelings of insecurity are going to come right to the surface. Again, a symptom of BPD is difficulty trusting, which is sometimes accompanied by a rational fear of other people's intentions. Then you're going to have, again, feelings of disassociation, such as feeling cut off from oneself, seeing oneself from outside one's body, or feelings of unreality. Now, I want to tell you this. Not everyone with borderline personality disorder experiences every symptom. Some individuals experience only a few symptoms while others have many. Now, symptoms can be triggered by seemingly ordinary events. For example, people can be triggered by seemingly ordinary events. Again, I'm going to give you an example. Anger comes out of BPD. People with borderline personality disorder can become angry and distressed over minor separations from people to whom they feel close, such as traveling on business trips. Now, the severity and frequency of symptoms and how long they last is going to depend on the individual and their illness. Now, there are risk factors that you have to consider when it comes to BPD. Now, the cause of borderline personality disorder is not yet clear, but research suggests that genetics, brain structure and function, and even environmental and cultural and social factors play a big role or may increase risk for developing borderline personality disorder. Now, when you bake a cake, in order for that cake to come out the way you want it, you got to add the right ingredients. Now, when I break down the risk factors, I'm going to add the right ingredients so you're going to understand where the risk factors come from. Now, first of all, most of the foundation is set by family history. And I say that because people who have a close family member, such as a parent or sibling with the disorder, may be at higher risk of developing borderline personality disorder. And we break it down again and we talk about brain factors. Now, studies show that people with BPD, which is borderline personality disorder, can have structural and functional changes in the brain, especially in the areas that control impulses and emotional regulation. However, it is not clear whether these changes are risk factors for the disorder or even caused by the disorder. And third, I mentioned environmental, cultural, and social factors. I want to break it all down. Many people with borderline personality disorder report experiencing traumatic life events such as abuse, abandonment, adversity during childhood, while others may have been exposed to unstable, invalidating relationships or hostile conflicts. Now, again, this is another disorder where you could see PTSD, post traumatic stress disorder. Again, I told you in the beginning that you were going to have the feelings of abandonment. Because again, when we deal with personality or borderline personality disorder, it's almost like a hot and cold or Jekyll and Hyde relationship. The person is very unstable and unpredictable. You don't know what's going to come. Now, I will tell you, as I broke down these components, although these factors, and I got to put a however, these factors may increase a person's risk. And if that happens, it does not mean that the person will develop borderline personality disorder. Now, likewise, there may be people without these risk factors who will develop personality or borderline personality disorder in their lifetime. Again, as I broke down the factors, family history, brain factors, and cultural, environmental, and social factors, these are potential factors that keep a person at risk of having borderline personality disorder. It does not mean that you will develop BPD. And again, you can have people who don't even have any of these risk factors who will develop BPD. Now, with all that being said, the $1,000,000 question is, how is BPD, which is borderline personality disorder, treated? I'm going to get to that right now. Lay it out like a red carpet. Now, when we get down to the treatments and the therapies, I'm going to just tell you this. BPD has historically been viewed as very difficult to treat. However, with newer evidence-based treatment, many people with the disorder experience few and less severe symptoms, and their quality of life is definitely improved, because it is important that people with borderline personality disorder receive evidence-based specialized treatment from an appropriately trained provider. Now, one must remember that other types of treatment or treatment provided by a doctor or therapist who is not appropriately trained may not benefit the person. Again, just like lawyers, you got different doctors. And if you are not specialized in treating a patient with BPD, they're still going to have the symptoms. Now, again, many factors affect the length of time it takes for symptoms to improve once treatment begins. So it is very important with people with borderline personality disorder and their loved ones to be patient and to receive appropriate support during treatment. Now, again, everything is a process. So now that I've broken down the risk factors, I've gotten into the treatments and therapies, now we can get down to the test and diagnosis. Now, basically, a licensed mental health professional, such as a psychotherapist or psychologist or a clinical social worker experienced in diagnosing and treating mental disorders, can diagnose borderline personality disorder by basically completing a thorough interview, including a discussion about the symptoms. Also, they can perform a careful and thorough medical exam, which can help rule out other possible causes of symptoms. And also, the big item, and this is a big ticket item, you got to talk about family histories, because let me tell you something. You may be healthy one day and you may keel over the next day. And that's based on your family history. And this is why your health and your behavior is very important. Now, I know our number is going to be called one day, but while you're here, you want to take care of yourself so you can enjoy life. And a lot of us have problems. And I see a lot more depression issues when it comes to these younger folks. And I can't wait to do the video on depression because you got to hear what's going on with these young folks out here. I've never, ever heard such a thing in my life where young folk are getting more and more into substance abuse and alcohol themselves because, again, it's all around them based on the environment that they were brought up. Now, again, won't we get into the last part of the diagnosis? And I was a little long-winded on the test and diagnosis part. The last thing you need to do as a licensed therapist, psychologist, or clinical social worker is definitely ask about family medical histories, including any history of mental illness, because your family background can give you a lot of information. And it will make it much easier for licensed professionals to diagnose the problem. Now, again, when we deal with BPD, it basically occurs with other medical illnesses. And I say that because incurring disorders, like what if you have stress and BPD and anxiety? Now you have a three-headed monster because you can solve one, or you can solve two, or you can solve all three, or you may not solve any. Now you have a problem, two problems, three problems that are going to make you more and more unstable. So, again, this is why you have to follow the process and you have to admit you have a problem. And by admitting you have a problem, it's going to be much easier for a licensed mental health professional to diagnose the issues. Now, again, concurring disorders can make it harder to diagnose and treat borderline personality disorder, especially if symptoms of other illnesses overlap with the symptoms of borderline personality disorder. For example, a person with borderline personality disorder may be more likely to also experience symptoms of depression, bipolar disorder. Now, it's funny when I talk about bipolar. I should say bipolar is actually more of the Jekyll and Hyde because it's very similar to borderline personality disorder. Why? Because you have mood swings. And I just mentioned anxiety. Now, it's funny, I'm not a psychologist, but I studied psychology. I wanted to be a psychologist because I think it's very interesting when you study the symptoms and the behaviors because you can see how people react to situations. And it's very important that you understand what's going on with people, particularly if you're going to work around them or if you have a relationship, because you don't want unstable people coming into your life because you may not have a life because they may do something crazy, or yourself, you may do something crazy. But again, when you have a borderline personality disorder, it's more likely that you will experience a connection with bipolar disorder, anxiety disorders, also substance use disorders, or even eating disorders. Now, what you have to do is seek and stick with treatment. Now, the NIMH funded studies show that people with borderline personality disorder who don't receive adequate treatment, I meant adequate, not adequate treatment, are, number one, more likely to develop other chronic medical or mental illnesses. Number two, they're less likely to make healthy lifestyle changes. You see, borderline personality disorder is also associated with a higher rate of self-harm and suicidal behavior than the general public. Because people with the borderline personality disorder who are thinking of harming themselves or attempting suicide may need help right away. Now, I'm going to just put this information out there. This is why I call myself the 411 Talk Zone radio show. Because if you or someone you know is in crisis, you got to call the toll-free number, and I call it the NSPL, the National Suicide Prevention Lifeline. And that number is 1-800-273-8255. Again, that number is 1-800-273-8255. Now, that number, of course, operates 24 hours a day, 7 days a week. And what's good about it is because the service is available to everyone. The deaf and hard of hearing can contact the Lifetime via TTY at 1-800-799-4889. That's for the deaf. 1-800-799-4899. Now, remember this, when you make the call, all the calls that you make are free and confidential. And of course, contact social media outlets directly if you are concerned about a friend's social media updates, or dial 911 in an emergency. But again, remember something. The treatments that I've talked about, which are part of this article, are just some of the options that may be available to a person with borderline personality disorder. Now, I gave you the information on who to call. Let's get into psychotherapy now, because psychotherapy is the first line of treatment for people with borderline personality disorder. Why do I say that? Because a therapist can provide one-on-one treatment between the therapist and patient, or treatment in a group setting. Now, therapist-led group sessions may help teach people with borderline personality disorder on how to interact with others and how to express themselves effectively, because it is very important that people in therapy get along with and trust their therapist, because the very nature of borderline personality disorder can make it difficult for people with a disorder to maintain a comfortable and trusting bond with their therapist. Now, I'm going to give you two examples, and they include what I call dialectical behavior therapy, known as DBT. Now, this type of therapy was developed for individuals with borderline personality disorder, and one must understand that DBT uses concepts of mindfulness and acceptance of being aware of and attentive to the current situation and emotional state. Now, DBT, which is dialectical behavioral theory, also teaches skills that can help control intense emotions, reduce self-destructive behaviors, and of course, improve relationships. Now, the next one is one of my favorites, and you hear it all the time: cognitive behavioral therapy, known as CBT. Now, this type of therapy can help people with borderline personality disorder identify and change core beliefs and behaviors that underlie inaccurate perceptions of themselves and, of course, others, and problems interacting with others. CBT, known as cognitive behavioral therapy, may help reduce a range of mood and anxiety symptoms and reduce the number of suicidal or self-harming behaviors. Now, again, when it comes to any type of symptom, how do we take care of the symptoms? I didn't say cure. I said, how do we relieve the symptoms? We use medication. Now, because the benefits are unclear, and I'm talking about borderline personality disorder, medications are not typically used as the primary treatment for BPD. However, in some cases, psychiatrists may recommend medications to treat specific symptoms as depression, mood swings, and other occurring mental disorders. Now, treatment with medications may require care from more than one medical professional because certain medications can cause different side effects. And are they approved by the FDA? You bet your ass they are. Just like the jab. Again, got to be careful when you deal with medications because even these that have been approved by the FDA can cause side effects in different people. So you got to talk to your doctor about what to expect from a particular medication. Now, other elements of care. Some people with borderline personality disorder experience severe symptoms and need intensive, often inpatient care, while others may use some form of outpatient treatments, but never you need hospitalization or emergency care. And that's the thing to tell you. Today, a number of us get a little cut and we want to go to the emergency room. No. If you understand the treatments, whether they're inpatient or outpatient, save yourself the money. Understand what the inpatient and outpatient care are. You'll never need hospitalization or emergency care. Now, one must understand when it comes to caregivers and family members. Well, when we deal with families and caregivers of people with borderline personality disorder, what can happen to caregivers and family members? They may also benefit from therapy because having a relative or a loved one with the disorder can be stressful, and family members or caregivers may unintentionally act in ways that can worsen their loved one's symptoms. Now, some borderline personality disorder therapies include family members, caregivers, or loved ones in treatment sessions. This type of therapy helps by allowing the relative or loved one to develop skills so they can better understand and support a person with borderline personality disorders or a borderline personality disorder. You may have other disorders that are also integrated with BPD. So you got to be careful of that as well. And also, you got to focus on the needs of family members to help them understand the obstacles and strategies for caring for someone with borderline personality disorder, although more research is needed to determine the effectiveness of family therapy in borderline personality disorder studies on other mental disorders that suggest family members can help in a person's treatment. Again, when we deal with BPD, we still need more research. And that research is on the effectiveness of family therapy in borderline personality disorder studies on other mental disorders that suggest that including family members can be a help in a person's treatment. Now, I'm just going to say this. Here are some tips. If you have to help a friend or relative with the disorder, you got to offer emotional support, understanding, patience, and encouragement. Why? Because that change can be difficult and frightening to people with borderline personality disorder. However, it is possible for them to get better over time. Also, you need to learn about the mental disorders, including borderline personality disorder, so you can understand what that person with the disorder is experiencing. And you also encourage your loved one who is in treatment for borderline personality disorder to ask about family therapy. And also, you can seek counseling for yourself from a therapist. It should not be the same therapist that your loved one with borderline personality disorder is seeing. Now, something else you can do, because you have it going around. And when I mean have it going around, BPD is still being studied. Well, you can even join the study, because clinical trials are research studies that look at new ways to prevent, detect, or treat diseases and conditions. Now, the goal of clinical trials is to determine if a new test or treatment works and it is safe. Now, although individuals may benefit from being part of a clinical test, participants should be aware that the primary purpose of a clinical trial is to gain new scientific knowledge so that others may be better helped in the future. And again, you talk to NIMH and around the country, what they do, they conduct many studies with patients and healthy volunteers. They have better treatment options today of what clinical trials uncovered years ago. So being part of a study, just don't be like the Tuskegee experiment, because that was a study that was very much unfair, or the Homestead prison in Philadelphia. But again, when it comes to any type of disorder, now I'll put a little bit of fun into doing this video, but let me get serious. Disorders can hurt the person who has the disorder, and it can also hurt the person who doesn't have the disorder. And, we've all had some type of issues. I know I've had impatient, anger issues myself. I went and seeked help. I got stressed. And sometimes I talk about the family situation. It's not necessarily the family situation. It could be on your job, be in a relationship you have. It could be friends you have. And sometimes you got to get rid of those people to help you out as well. I know we talk about therapy. Sometimes you can use self-therapy. But if you have good people around you who are willing to understand and help you get through the problem, and it does take a lot of patience, it takes a lot of tenacity as well, because when you're dealing with an individual who has a disorder, it's going to suck the life right out of you. Why? Because you can't really have yourself a life, because you're trying to help this other person who has a disorder. But one thing I will tell you is this: you have to educate yourself. Now, again, what I'm doing here on the 401 Talk Zone radio show, I'm giving you an overview. You got to get into the DSM-5, the Diagnostic and Statistical Manual, and the ICD, which deals with the international. Both are the Bibles to mental disorders. And there are a lot of mental disorders in the DSM-5. Now, one mental disorder that they took out was homosexuality. That was in the early DSMs. But I'm going to be doing videos on paraphilia. Now, a lot of individuals talk about pedophilia, but paraphilia, what is that? I'm going to tell you what paraphilia is right now. Paraphilia is sexual deviancy. I mean, it can involve voyeurism. I'm just using straight up common sense here. Voyeurism, inanimate objects, bestiality, all kinds of, I'm just going to say, outside of a man and a woman, it can get very, very, very offensive to people who are living alternative lifestyles. And alternative lifestyles just don't mean homosexual lifestyles. get into threesomes. You can get into polygamy. And I'm not talking about polygamy for marriage. I'm talking about polygamy as far as having all kinds of partners, swingers. I mean, that's all alternative behavior and alternative lifestyle. Because, see, that's something that a number of individuals don't know about either because their minds are closed. We tend to look at alternative lifestyles as homosexuality. No, there's a lot of other things that go on. And paraphilia, again, is known as sexual deviance. And I'm just giving you some examples of what actually takes place. And I know you hear a number of individuals talk about the alphabet community. There's a plus at the end. They want to put the P at the end, which stands for pedophilia or pedo for short. That's also a deviant behavior. Incest is a deviant behavior. But see, you have a number of individuals out there that they really don't want to hear this information because, number one, they, like I said at the beginning, they may have been a victim or a perpetrator. But in the end, how do you treat those people? Because individuals who've been victims of any disorder, for the most part, if they don't get help, they'll never be able to pair bond with anybody. I don't care what your preference is, whether you go for same or whether you go for difference, you're always going to be bringing in baggage from the past. And that's, I call it basically post-traumatic stress disorder. I know somebody that's been RAPED in the past and they kept it silent. That's also going to be something that is going to create a life of, I'm going to say, possible promiscuity. And something else too that individuals don't want to talk about. We talk about feminism. You know, the free sex. Well, a number of those individuals have borderline personality disorders, and they're also deviant too. And this is why a number of men and women, I mean, you can see all the perversion going on. And so Russell Westbrook in a dress. You got people like Lil Nas X. These individuals have warped minds. Dwayne Wade, look at this 12-year-old kid. And what I see what's going on with some of these kids, because a number of these disorders can basically happen when a person's a kid. And when I get into the deviant behavior, I'll talk more about it because a lot of this has been brought on by the media and education. But again, you know, going back to a borderline personality disorder, with that kind of disorder, you basically have a behavior that's unpredictable because you can be happy one moment and you can be depressed the next moment. And then you can end up with anxiety. You can end up with bipolar. You can end up with so many other disorders that at the end of the day, your mindset is so messed up. It's messed up because you fail to get help. And like I said, some of us don't want to get help because we're afraid of what somebody else is going to say. Listen, it takes more of an adult to say, hey, I need help than it does when you don't say anything. And this is all common sense. You don't even need a degree to actually listen to what I'm saying. Because, you know, in the long run, I'm not going to steer you wrong. I'm breaking everything down in layman's terms, because again, you got psychologists out there who are much more experienced than I am in delivering this information. But when you have disorders, you need a foundation. It's just like a house. You can't put the roof on without laying the foundation. And if your foundation is bad, your house is going to collapse. Well, if you have a disorder and you don't solve that disorder or relieve the symptoms of that disorder, again, just like I said, it can last for hours, it can last for days, and it can last for years. So in the end, I'm just going to put this information out there. If you have a disorder, number one, look at the symptoms. Look at how you're acting or behaving. And if you are acting in an irrational way, you should seek help. Because if you don't, you're going to harm yourself and you're going to harm others. And that's my commentary for this edition of the 411 Talk Zone Radio Show right here on YouTube. If you like what I just presented, please comment, share, and subscribe. And of course, hit the Cash App at the bottom of my comment section. That is $LEJ01021965. And if you are looking for some content with some more education based to it, check out my second channel. I have over 100 videos on that channel. Not many people look at it. It's called the Mind of STEM channel. And on that channel, I give you a daily dose of science, technology, engineering, and math. And some of the subjects that I talk about range from calculus to industrial engineering, chemistry, and dynamics. And I haven't done it in a while, but I'm going to work on doing some blog talk radio. And the reason why I haven't done blog talk radio, because I've been doing YouTube with Zoom, and I've done some blog talk radio episodes with Zoom. I like to cam up so my audience can see who I am and they can get an idea if they have a belief that I know what I'm talking about, and I have a belief that I know what I'm talking about as well. Now, the guest calling number for my blog talk radio show is 215-383-5785. And I'm also working on how to do live streams with StreamYard and of course Zoom. So I'm gonna get my brother Nate, shout out to you to help me, and shout out to brother SKC as well. Again, shout out to Mr. Palmer. Give you a good shout out. Shout out to Abu Osama. Shout out to a number of guys out there that I hop on Little Big Nate's panel with. Now, that being said, if you cannot find me on YouTube or Blog Talk Radio, you can catch my Mind of STEM videos on Twitter. And then you can catch my 401 Talk Zone radio shows on Twitter, MeWe, and Parler. Now, the reason why I don't post my Mind of STEM videos on Parler and MeWe, because those are political sites. Now, I will try to upload my Mind of STEM videos to my LinkedIn account. But for the most part, number of individuals, they never heard of LinkedIn or they just don't go to LinkedIn. But other than that, you can check me out on Twitter. And at the end of the day, I'm going to leave you with this. Be blessed for what you have. Don't worry about what you don't have. Always know that the sun rises in the east and sets in the west. And with this video, if it doesn't apply, let it fly. But if the shoe fits, wear it. If you don't like the shoe, changing. And once again, thank you for listening to this edition of the 411 Talk Zone radio show. Please like, share, and subscribe, because at the end of the day, information is powerful. And again, my name is Leon Jones, and I want you all to have a wonderful and gracious evening. God bless you. I'm out.